Y'all, welcome back to another episode of the Empowered Place, Empowered Lives podcast. It's your healthy habits and lifestyle coach, Giovanni. Y'all, this is the safe space for those with endometriosis, polycystic ovary syndrome, adenomyosis, and fibroids to come get empowered about your healing journey. Y'all, we have a special guest in the Good Vibe studio today. But before we get into this episode, and if it's your first episode, get ready because it's time to vibe with me, y'all. Welcome to the Empowered Plates, Empowered Lives podcast. Y'all, welcome to today's episode of Empowered Plates, Empowered Lives podcast. We are honored to have with us today Cheryl Graham, a wellness powerhouse with over 25 years in nursing and 12 years in the wellness industry. Y'all, Cheryl's journey is a testament to resilience and the power of holistic wellness. From battling hyperthyroidism and defying grim medical predictions to launching her very own IV therapy business, y'all, Cheryl has dedicated her life to transforming health and wellness. Today, she will share her insights on the importance of health span over lifespan and the power of a plant-based diet and the benefits of integrative wellness practices. Y'all, stay tuned for an enlightening conversation that promises to inspire and empower you on your wellness journey. Y'all give it up for Cheryl.
Girl, thank you for that introduction. My God, I need those notes. I love it.
Man, I love you. And I thank you for coming to vibe with me. So guess what, Cheryl?
What?
We were already talking about your journey from dealing with like severe health issues to becoming a wellness powerhouse. Can you just share like the pivotal moments that led you to transition from your traditional nursing background to embracing your holistic wellness through IV therapy?
Wow. So 2012 was that year. I want to say April of 2012. I was working, I was at the nurse's station. I completely stopped in the middle of the nurse's station around all the confusion. So if you can imagine, tons of nurses, doctors, I was in the middle of the floor just standing there. Like, I didn't know what was happening. I felt like my mind was going, like I was having an anxiety attack. And I would just left the patient's room. So I still had things to do. But in between all that happened, I said, I got to get some help somewhere. I just wasn't feeling good. And I was sick and tired of being sick and tired. And I think it was at that moment that I hit a brick wall, like a brick wall in the middle of that nursing station. I hit that brick wall. And that was my moment to say, what am I doing? And I think it was, like I said, I know it was God telling me or showing me, I'm going to stop you here before you do more damage to yourself. That was that moment because I didn't know what was happening.
So what was going through your mind? What was your body feeling? Like you just got stuck. You were doing your rounds. You were headed to the nursing station. Like, what was it in your body? Was your body trembling? Were you just having an out of body experience? Like at this point, what do you think it was?
You said that. I think it was an out of body experience, and looking above and looking down at what was happening to myself. Like I was just in a hamster wheel going nowhere. You see how hamsters run and they think they're doing something. They're not going anywhere. They're just in that ever rolling wheel, standing still, thinking you're moving forwards, but standing still. And so I felt overwhelmed. I remember my heart was beating so fast. I already had these tremors in my hand. I didn't know what was going on, but it was just like, wow, what is happening here? Because I feel like I'm mostly in control. I have an even keel throughout the day. I don't let anything bother me because, when you're with patients, you want to keep a steady keel because they're in an emotional state. You want to be their solace. You want to be that person that they can lean on, but I couldn't do it anymore. I couldn't do it. That day was just, that was the change in things. So I immediately went, I don't know if it was lunch break, whatever happened. I went to see my doctor because I said, there's got to be something's going on. And people know me and they're like, something's not right. So I went to the doctor. For my medical doctor, she sent me to an endocrinologist. And then, well, let me back up. She did labs on me. I got the lab work back. She didn't like it. She sent me to the endocrinologist. And from there on, things started rolling because I didn't know. I always thought, I got doctor friends. Can you sign my physical? I'm good. I'm good. That's how we do. And I just kept it moving. But that time I was like, nah, something's wrong.
How long do you think it took before you got to this outer body experience to know that you were masking so many different things and just pushing it down, because there's an art in nursing to put everybody else before you, that you kind of forgot that you were putting everybody before you, and now it's this point where now you're having to now start going through the healthcare system for your own navigation of journeying and trying to figure out what's really going on.
So I can't pinpoint the time. Only thing I know is from the diagnoses of when I went to an endocrinologist, he got the labs back and he diagnosed me with hyperthyroidism. From that moment, from originally seeking that doctor and going to him, there had to be the span within 2 weeks. And then from him placing me on these medications to me taking a look at, Cheryl, what are you actually doing? Like, I wanted to do a scan or a highlight of what am I actually doing on my day-to-day basis, how my routine is. And I pinpointed, let me look at what I'm putting on my skin, because I heard from another nurse friend, she was like, you got to watch out for these things that you're buying in the stores because they have a lot of parabens and tetraparabens and a lot of acids that do some changes to your estrogen, and our estrogen hormones in our body regulate a lot of things in our body. It's a few more hormones. However, I said, let me take a look at that. And when I would go in, I read parabens, tetraparabens, like what is this whole slew, this list of ingredients in these items I'm using, how was that affecting my body? So I made the change and I started using some products from Arbonne, which were toxic free. And, I was seeing the doctor. So I was going back and forth to him and he was checking my labs. And one day he said, oh, your labs are trending towards normal. And I said, oh, that's good. I'm excited. I'm thinking that's good, right? He's like, what are you doing? I said, I changed the way I was eating. I stopped using products that had a lot of chemicals. I was going to Bath and Body Works. I was mainly using that. So the body wash, the lotion, the oils, the candles, and then I did have a perm in my hair at the time. And so all that, this man looked me in my eye like I'm looking you in the camera. He said, you have a brain tumor. And I was taken aback, like, I know he's crazy. Like, there's no way. There's no indication. You didn't do an MRI, nothing. And mind you, prior to that, to work up this hyperthyroid diagnosis, he had me do a thyroid uptake scan where I would swallow a pill. They would scan my thyroid. That was normal. My labs were just off. I didn't have the bulging eyes or anything significant that people see with hyperthyroidism. So I was like, no, there's no way. My gut, JoJo, my gut was all twisted, turning, like I think it was like knocking on the door, like, don't you listen, do what you're doing. And so he did an MRI and the MRI was negative and there was nothing else he could actually say beyond, okay.
So you saw improvement through changing your diet, changing the products that you were putting on your body to ones that were less toxic, more so toxic free. And because you had these types of results, making your own holistic changes, he automatically said, oh, well, you got a brain tumor, because the results were just too unnatural for him to say that you did this without any type of medical treatment. Let's take this back just a little bit, Cheryl, because I think that's I love that you said that, and I love that your gut was telling you, no, you're doing good things despite whatever scare tactics he might be believing, because he doesn't believe what you believe in, holistic remedies and holistic wellness and well-being. Let's take it back to this thyroid issue. How do you believe stress played a part in your thyroid toxicity and issues that were kind of happening in your life, that made you start to shift the way you were eating as well as what you were putting on your body?
So if I could take it back to in nursing school, I remember us having this amount of nutrition. but a whole slew of basically a class on pharmacology. And knowing that a lot of doctors push medications, because I was there when the doctor was telling me about that. There's no way this can happen. This, you need to stay on these pills. And just taking account to, you hear so much about people changing their diet. And I was a advocate for my patients that would come in the hospital, like they were frequent flyers. And I was wondering what the disconnect was. And it was home, the environment, the community, and it could have been the food bank or the lack of, what do they call them? Food, deserts. So in my mind, just thinking, could it be that could be what has made the change for me? Because I went as far as changing my diet and adding better products into my skincare system. Our skin is our largest organ, so what we put in absorbs right into it. So I think all that together helped me realize you're making. I think you're making a good move for yourself, because I even felt better. And so, for me, I could fake how I was feeling because I had the cystic acne. My face was ravaged with red pustules that were draining, that were painful to touch. I mean, it was horrible. So I could fake feeling good, but when you don't look good and your face is your first presentation to people, besides when you open your mouth and how you come in your energy, just being at that moment, I'm like, okay, I don't have to fake it anymore because I'm actually feeling better and things are changing. So just noticing that and being able to say, okay, let me stick to what this is doing for me. Um, and let's see what plays out. Let's see.
Okay. So you changed your eating, you
Yeah.
changed what you were putting on your body. Um, any life changes happen that might have been causing you distress that also could have played a role in your mind body renewal in regards to the embrace of this new journey for you.
Yeah. So as you asked me, and I went on a tangent, the stress that was in my body, I probably was masking. I was in a bad marriage,
Mm.
and I was masking my happiness. I'm going to put air quotes, my happiness. You can't get happiness from anyone else. It comes from the inside. And so I wasn't feeling fulfilled as a person, let alone a woman. And to want to give my all, like you said, how we nurses give our all to everybody else and we don't pour back into ourselves. So I think with that, always trying to people please and try to say, oh, it's going to get better. Let me work at this and not work on the inside. That stress there, trying to people please and trying to create this happiness that I was looking for, I know that played a pivotal point because I couldn't make anybody else happy, and I was not trying to make myself happy because I thought the outside would turn and play on for me. And so that stress there played a pivotal point because I felt like I wasn't worthy.
Mm.
I felt like I wasn't going anywhere. I was stagnant in my life. And I'm like, there's got to be more. There's got to be. And I think once I realized there was more, then I started putting myself into perspective and adding myself into the calendar to start taking care of me. Because I figure I can't take care of anybody else if I'm not well. And it didn't hit me because I was going, going, going. I was always moving and doing for other people.
And I just want to give a pause for anybody who feels like how Cheryl was feeling at that particular point in time to just say, give yourself grace.
Yeah.
And it's better late than never to start prioritizing you and taking care of you. And so when that inner work starts to happen, lean into it. No matter how discomforting it may be, no matter how awkward it might be, lean into learning and loving you to take care of you so you can have that impact to the world, so you can start leaving a legacy. But it first starts with you being on your own intentional healing journey and being aware, so then that you can surrender to those things, so then that way you can set yourself free. And so Cheryl, what I want to ask is for that person who was that Cheryl back in the day, who was having that outer body experience, stuck all of a sudden, just frozen in the middle of her regular day flow, now being in a sense of shock because her body kept going, and masking and not taking care of itself. Give some tips for people to now help them make that shift that you ended up having to make for yourself that doesn't know where to start?
Okay. First, I think you need to sit by yourself. Sit by yourself alone, wherever your safe space is that you can make for yourself a quiet space. And I don't know where you are in your journey, people who are watching, but if you rely on the Almighty and have Him tell Him what you need, sit in your quiet space and be able to download the information you receive from Him. And I think I missed that at the beginning because there were indicators as to, I need you to listen to me. And I wasn't listening. And once I listened, when I tell you my life changed, doors opened up, my eyes opened up, things, it made a difference. So sit with yourself and try to reflect on who were you before this episode, or who were you before, even before somebody else came into your life. So sit down and reflect on that. Try to establish a route, not try, establish a routine. Write down some things that you would enjoy for yourself to make you happy. We're going to start externally, and then we're going to work internally, because that's going to make a difference. So write down a routine, like what would in the morning. For me, I would get up. I started reading the Bible more. I started doing devotions. I love the Bible app because there are areas there where you can pull up different, if you're feeling anxiety, stress, fear, doubt, you can pick any subject and then you can find something to read on. So every day I started reading that. I took the time for myself. I started a gratitude journal. That's so important. Every day I write down 10 things I'm grateful for. And so as I started doing that, and I started hydrating more, I know that may sound crazy, but I started hydrating more. They say in the morning, if you hydrate, you are opening up your cells and you're allowing that water to flow through. We are 70% water, so we need to make sure we drink. And dehydration is big at night. It happens at night. Our bodies do so many miracle changing things. It helps us with restoring and replenishing. So we lose a lot of water doing that. So first thing in the morning, started drinking water as well. And so I would bathe my cells with water. And so I started doing those things. And I believe I added some exercise to it. So that opened up a lot too. Those endorphins started flowing. I started feeling better. I started looking better. And it just made a difference. And I even look back on my Facebook and I see the shift. It was 2012, July of 2012. I would have some sarcastic moments. And I was like, ooh, that's when that pivot came. That was that same year everything happened. And that was the month where I asked for divorce from my husband, my ex-husband. So everything is lined up.
I love it. So this is 12 years ago to date, because we're currently right now at the time of this recording in July of 2024. So 12 years ago today. So I love it, Cheryl. So anybody that's listening and you're now starting to prioritize you, starting to take care of you, the first thing she said to do is sit with yourself. Sit with yourself, see what thoughts you start to download, what comes to mind, what you're more aware of. Then reflect on the things that now you're thinking about, what you believe is true, what is not true, what you want to see in regards to yourself. Then start establishing a routine externally, things that you can do that already make you happy, that you know makes you happy, and start doing more of those things. And as you do more of those things, it's going to start to turn inward into your own heart, and you're going to find more love into what it is that you're doing. And then take more time for yourself. Self-care is a big thing. And sometimes we hear that term as being overrated, but even just taking a shower and being intentional with the shower that you take and the time that you spend in that shower, making it a true spa treatment, and a mindset shift for yourself to even get your day started, or winding down from the day and taking the day off of you and letting it go into the drain before you lay your head down is a big thing. Gratitude journal. When you say that has been a huge shift for my clients as well, Cheryl. Just being grateful, the simple acts of being grateful for whatever comes to your mind. Because sometimes when you're looking into gratitude, and I'm sitting in front of a class with my students, I'm being grateful for my students. Then other times I might be, if I'm doing my gratitude journal while I'm at work, I might also be grateful for my job and the way I've been able to impact and the accomplishments I've had. When I'm at home, it might shift to family, it might shift to friends, it might shift to my golden doodle Spencer. Like, gratitude has a way of just showing up in that present moment in so many different ways. So if you sit with that gratitude, you start to really become more appreciative of who you are, and what it is that you want to accomplish more about. And it starts changing that inner voice in your head that says, man, I am so blessed. I am so grateful for all the things that I do have, instead of looking at the things that you don't have or the stuff that's outside of your control. So that gratitude journal is a life changer. I won't even say a game changer. It's a life changer for so many people. And then the simple act of hydrating yourself. I thought that was really important. Of course, you as a premier IV specialist, I know hydration is definitely something that you really, push in regards to making sure your body has everything that it needs to be functionally well, to show up for you vibrantly throughout the day. And then exercise. I love that, because some people forget that there is healing in movement, and when you move, you heal. So Cheryl, just to ask, just in this point, because you left on the exercise moment, what was that first form of exercise for you that really got you going, that you really enjoyed, that say, you know what, I'm gonna do more of this throughout the week?
Tybo. I love Tybo. Billy Blanks. I still remember some of the yes. And it didn't have the music on, just following his steps. And it was just movement, 30 minutes a day, if that. And then I started feeling better. My energy started coming up. I had more endurance. My mind started clearing up. I'm like, okay, I like this. And I was doing it more and more often. And I established a routine, and the consistency set in, the changes happened, and I moved forward. And I was like, give myself a pat on the shoulder, because
Don't underestimate that move forward. Now, it's the four vibrations that keep you going on
right.
that healing journey. And I think that's what sometimes stops people from continuing to be intentional about being intentional on the things that help them feel better, and helps them heal holistically, is once you start seeing the benefits, lean more into that. Like, don't let up off the gas. Floor that thing and just keep going, and keep going until you figure something else out that you want to try differently. And it's okay to try different things and you don't like it. At least you tried it. Like, and there was still healing in the fact that you tried something different and it showed you more about yourself. So I like that you put that movement in there. And you also talked about like being on a plant-based journey. So how did you like really adopt a plant-based diet to impact your health, and what tips would you give to other people starting to embrace that lifestyle? Because we all know, Cheryl, there's a relationship with food that people have a hard time changing, even if that means it's going to change their life for the better. So talk us through how you started to make that shift for yourself, that saw the results with your endocrinologist, saw that you really didn't have as much of a thyroid issue as they thought. And then we rebuked that brain tumor in the name of Jesus that really wasn't ever there, that started your results to go the way they did. Talk us.
That's loaded. Okay. So I always love vegetables, and I could eat meat every now and again. But I think it was when I started reading the packages, when I started really thinking about me, and like, what am I doing? Like with the skincare, I started with the skincare, and then I think that went into the meats and looking at the ingredients, and like, they will fool you on these on the packaging. No extra added antibiotics, no extra added antibiotics by in addition, whatever, they'll use all these marketing ploys. You're like, And then I saw
natural flavors. Don't forget that one.
No, yeah. I saw a young chicken, and then I saw another chicken. That the young chicken was small, as I remember I would see back in my day when I was a kid. The other chicken was huge. The breast was huge. And then as I'm going along with Arbonne, we learn as far as how they put the hormones and they inject. And you see it on What the Health. You see all these videos out there that they're plumping it up. Like, how was this bird a young chicken, but this is a young chicken? And then you learn about how it usually takes 78 days from hatching to get a grown chicken, whereas now it's 45 days because of the hormones. So you're getting you're getting faster growth in these chicks. They're out to the stores faster. You're having the turnover. So we're eating all that stuff in there. So that started to take a toll on me. Like, let me lay off for a minute and see what happens. And I found out I didn't have what we call the itis. I wasn't getting tired after my meals. I was more energized. My thought pattern opened up. I felt good. Like, you don't know how good you feel until you feel good. And so I kept on that journey, like, oh, I like this. I didn't need to have the meat. Now my friends are like, you should do it because blah blah. No, let me stick to what I'm doing. And by that time, I don't think they had any. They had tofu, but I didn't see any like Impossible Burger or anything like that. That hadn't come around. But I started doing that. But I would eat wild caught fish, some salmon. I would stay away from the tilapia because I never ever heard of tilapia growing up in my life. So I'm like, where is that? What is that? Anyway, so I got some of the wild caught, but again, I still didn't eat much. But I pleased my palate. I was making sure I used good seasonings for my food. I learned how to broil things. I hated Brussels sprouts as a kid, but I learned how to put them in the oven, broil with some olive oil, some salt and pepper, delicious. And so I started learning these different techniques, and I was like, I'm not deprived of anything. I felt good. That was my main concern, feeling good and being in my truth of feeling good and not having to fake the funk.
I
So
love that. So
yeah,
the thing to shifting to more of a plant-based lifestyle, eating less inflammatory foods. So
yes,
going more on an anti-inflammatory diet. I didn't hear you say anything about dairy. I didn't hear you say anything about sugar. I didn't hear you say anything about high processed foods. You started to adapt a different way of preparing your meals, but they were still full of flavor and you enjoyed them and they made you feel good. So you kept feeling good because it felt good to eat good and the foods were helping you. I like it. I absolutely like it. And I'm with you on the Brussels sprouts. I don't remember eating a lot of Brussels sprouts when I was younger, but just roasting Brussels sprouts with like bell peppers, onions, like just seasoning them and putting them with like some balsamic vinaigrette and putting them in the oven. Like, it is absolutely amazing. Marinating them and giving them to my brother to put on the grill when he's about to grill, a whole bunch of other stuff. Like, it's just a way of being able to really have good food experiences that still taste good. And I think for me, a lot of times I feel like people are afraid of missing out on
yeah,
stuff that they've always had. And in regards to missing out, it's the thought pattern. It's the thought process that you have that you feel like you're missing out. You can't miss out on something that you've already been having for 20, 30 something years. There's nothing you're missing out on because you've already had it for 20 something, 30 years. How about shifting and creating some of the things that you absolutely love, transforming them in a different creative way? So then you're adding 20 or 30 something years to your life just because you're making that shift. And see what wonders it does for your body. So you were talking about it earlier, and you were talking about the hormones and the acne. Do you have a history of fibroids or high estrogen levels? Have you ever had
history of fibroids. And I remember the fibroids were so severe. And when my cycle was coming on, I would be bent over with pain. I would have painful sex.
Mm.
Um, what else? Oh, when I had to ovulate, oh my God, that was the most painful thing ever. Every month I could feel the egg releasing. Like, it was just pain. And I remember learning that was prior to my change in what I was doing. And then when I made the change to this plant-based, I didn't tell you, I didn't feel anything. Like, I didn't have any pain anymore. I'm like, I'm not feeding them. And I realized that, like, I know God does things for us in divine appointment. And so what I learned from being an Arbonne consultant, we talked about the hormones and how the hormones are endocrine, excuse me, how some of those toxins are endocrine disruptors, and it can mimic estrogen. So therefore we have these tumors that start to multiply, and we get these fibroids in our body. My fibroids have stayed the same since I was diagnosed, and I'm 55, so probably in my 20s. So for 30 years, yeah, because my initial doctor wanted to do surgery because she said you're young enough, you can still have kids. I didn't want to have surgery. Let me figure out what I need to do so I won't have this pain here, because I had our uterus is shaped like a triangle. I had one on the top and one on each side. So the one on the top, she was concerned that it was pressing down and pressing down, and that's why I was also having frequent urination, because it was pressing down, and then my bladder it was a whole bunch going on, y'all. But that change helped with that as well. I was so excited and elated about that.
So how long did you have the issues with your fibroids, or your periods were painful? Was it always since you had a period? Did it not start until your 20s? When did you start realizing the painful periods, the painful sex? Since we now know the solution was changing your lifestyle, what did it look like prior to? When did it actually start to show up?
Let's see. So I know for sure in college with the pain, because I ended up going to the hospital because I didn't know why I was in such pain. My line sister took me to the hospital, and that was probably 2021. I got married at 25. So all throughout that time and learning, and then the change in my life happened, was I 42? So with 12 years ago, 42. But prior to that, because I hadn't started eating. It was different. I wasn't having that much pain. So I don't know what the change was before the
Was it the
12 years.
stress, you think? The distress you were experiencing? Did that
It
shift it?
it could have been. I say it could have really been, but I'm telling you, I know from making that change in the diet and the stress I let go of helped me with this whole entire change. And I never had surgery. Don't have a hysterectomy. I still have all my parts, and those little fibers are still there, but
No problems,
no
no
problem,
issues,
no
because
issue.
you're not feeding them anymore.
Eating
All
them.
the different things that go into causing those issues. So you're talking about these products that you're putting on your body, and you're Arbonne, right? So what advice do you have for listeners to start making changes in regards to toxic-free products? Because that was one of the big shifts for you,
Yes.
being that your skin, your integumentary system is like the biggest organ on your body. What are some ways that people can start being more mindful and switching to less toxic free products?
So you can research. You want Even if you want them to be vegan, you can make sure they're PETA, or is it PETA? PETA. PETA certified,
Yeah.
vegan, plant-based, toxic free. You want to make sure. And so things that have minimal ingredients in them. You pick up the bottle, turn the label over. If there's a ton of words you can't pronounce, put that back. Put that back. Start doing the research, getting those things that are plant based. And now, since we have a vast array of that, you can go to Target and get anything now. It's crazy. It's like right there. We can pick and choose. Now, the whole thing is for us to go ahead and stick with what we've been using because it's cheaper. But think about the long run. Either you want to protect yourself in the forefront, or you're going to pay for it in the back end. Let's pay for it in the forefront, because you don't have to use much of it. A lot of these products, a lot of those that had hormone toxins and everything, you have to use goo gobs of them. Think about the lotions you may have used before. You would put lotion on it, like, why am I still ashy? Because a lot of it had water, and a lot of it wasn't going to be absorbed into your skin. So some of these good plant-based products, you don't need much. They're going to absorb right into your skin. And so you got to think about that. It's, think about that when you're purchasing. But the labels were the first thing for me. Reading that label, and if it was so many words I couldn't pronounce, oh, they're going back on the shelf.
All
But like,
right, so we're looking for vegan on the products. We're looking for PETA, PETA, certified on the products. We're looking to make sure we can say and pronounce the ingredients that are on the products, to make sure that we're doing our best to minimize toxins in the products that we are using. And that's not just on our body, but also in our environment, stuff that we're cleaning our clothes and things of that nature with. So just being mindful, and don't try to do all of this at one time. Take it one step at a time. First, start with your body. What's on your body, even when it gets to the clothing and the types of material that your clothing is. Start with the changes that you can make, and then over time just get more and more aware and educate yourself on the different options that you have with being able to utilize these products, because being able to reduce toxins will definitely help those with endometriosis, polycystic ovarian syndrome, fibroids, adenomyosis, and other chronic conditions by limiting your toxin exposure. But let's get into this. Premier IV specialist. So how do we get into this new journey in regards to restore hyper wellness? Talk to me a little bit.
So it all started there. So I moved from LA in 2015. We drove cross country, and I said, I don't want to work in a hospital anymore. After realizing I was part of the medical system being a business, and I'm not negating it. We need it for emergency, but for chronic conditions, let's look at what we can do to help ourselves. That's just a side note. So moved to Atlanta, Georgia in 2015. Didn't want to work in a hospital anymore. I just went and said, let me see what other nursing jobs are out there. So I started out at a place called World Travel Care. And what I did, I was a consultant for those traveling abroad. So they would get different vaccines, which I learned so much about different countries and the vaccines that you need for that. Very interesting job. From there, I went to do employee health with Children's Healthcare. So it was all the employees, every last one, from the janitors on up to physician, the chaplains, everybody would come through. Learned a lot about people, helped them get all their packaging ready to the employees of Children's Health. They let me go there. And then from there, I had searched online for, I don't even know why I thought of infusion nurses. Infusion nurses. I always knew I was good at IVs. I was the go-to person on the floor. I would get mad at them, like, why don't you start your own IV first? But then I didn't know that was God's plan for me to get all this work, all this knowledge, all this understanding of how to start IVs. Who knew I was going to use this in this time of my life? So I saw infusion nurse, restore hyper wellness. This will be the best job you ever had. You're working alongside other nurses and clients. You have a good time, and you're helping people with their nutrients. And I was like, oh, this sounds interesting. Let me apply for it. I applied for it, did my interview on FaceTime, got it up. Yes. They accepted me for the position. I went in, the store was still under construction. That was in April of 2019. I learned so much from there about nutrients. I felt like I was back in school to learn about nutrients and how we're supposed to treat our bodies, and the amino acids and the minerals and things that we need for our bodies. I was on a high, like, learning, because I was like, this is exciting. Like, what am I lacking in my body? And so from there, it was interesting that people would come in prior to going on flights, or even after, even if you have a lot of student athletes that needed this bump up in their system, they need the fluids, they need to get these nutrients in. They may have a game or something, their parents want to hydrate them. And I was like, this is very interesting. Anybody and everybody was doing it. And I was like, I'm liking it. So I started doing it myself. I'm like, oh, another realm opened up for me. I was like, I feel phenomenal. So I liken it to the tune-ups in our tune-up for your car. And then my maintenance was me every day eating and doing, pouring into my body what I needed to. And then I added supplements. Girl, it took my body to a whole nother level. And so that was the journey that started everything. And I learned so much there. have to applaud them now for all the information that I learned that I could take with me in my head and apply it to what I'm doing now to help other people.
So walk us through this journey. We are Cheryl, and we are coming to restore hyper wellness. What does this look like? What are the process that you take to get all of the benefits, the wellness benefits of being that restored? Tell us what your process is. What do you start with, and how do you end with it?
Okay, so when I was there, it was a wellness center. So you had cryotherapy. Cryotherapy is like, or if you think about a freezer, you step into it, it cools your body down to maybe half of what your body temperature should be. But in the midst of all that, your energy increases. Your skin thinks it's freezing, it starts producing collagen. Your brain starts to trigger and open up and release some endorphins. You go into what's called fight or flight. So your body has all this energy, and it shunts the blood. So it helps you start thinking. You pick up these different proteins. So when you come out, you feel exhilarated. So I started with that. Then I learned about the red light sauna or infrared sauna. The infrared sauna treats your body as if you're having, or makes your body seem like you are having a fever. So internally, the toxins are going to be released through that sweat. And so the point is you have to stay into where you get to those minutes where you're like, oh my God, I got to get out. At that moment, when you feel like that, that's when things are breaking down and things are being released. You got to push past that moment. So I've learned that. Then I learned about red panels, the red light versus the infrared light. So people who had mood issues, who needed to sleep, who had skin issues, the red light would hit you right directly on your skin. It could help improve eczema, rashes, and things of that nature. The infrared light will get deep into your body, even into your bones, to help you with any pain. It even helped with the libido. It would help with your mood. So I learned all these things. And the fourth thing that we had there was called compression therapy. So it was like leg compression. So it was like your own mini massage on your legs, your hips, or your arms. And so when I started putting it all together, and I made my own mini day spa, in addition to using the IVs, I came out there feeling like I was on top of the world. I'm like, this is the key. This is what people need. And so my specialty with the IVs, it really took off because people were coming in to see me, because in my head, and I don't know if it's because I have a degree in biology as well, I would see what they needed and I would know what nutrients to give them without labs. If I had a lab test on them, I would know exactly what they needed. But just, sure, I'm feeling sluggish, I'm tired, I can't think. What do you think I need to do? I would devise a plan with the IVs in addition to the other wellness modalities. And they leave out there feeling amazing. And so I knew I had a gift. And I kept hearing it from my other clients. You need to start your own business.
So why is IV therapy so important?
Okay, so IV therapy is very important. It's something that's going to really start getting really big and blown up in the next moment or so. However, the fluids that you're bathing your body with, we can drink but so much in a day. These are going to go right into your vein, which means you're getting 100%. We call it bioavailability, meaning your body's going to use everything that you're putting into your veins. What it doesn't need, you're going to get rid of it either by urinating, mainly by urinating. So it's going right into your body. You're getting the fluids, you're getting some electrolytes, you're getting some of the nutrients, those antioxidants that you could be lacking from our food sources. Now, we know a lot of our food sources and our soil has changed so much that we're not getting the nutrients that we should be from our foods. So these IV can be your tune-up to help you get those nutrients that you are lacking and help you feel better along the way. So then you can move into developing a maintenance plan with your supplements. So the IV alone with the fluids, hydrating your body. As I told you, we need to hydrate our bodies with water throughout the day. But that alone will help you and keep you going. But you do need to continue adding on your regular water intake. This is something that's just going into your veins throughout your body. So your body, your cells are going to be pulling from everywhere. Anything that it needs, it's going to utilize that. And like I said, when it doesn't, it lets go. But you leave out there feeling hydrated. Your joints may feel extra lubricated. Your brain is going to, your thinking process is going to open up. And that's a big thing for me, thinking and that energy.
So what would the health span of society look like if IV therapy was affordable and accessible to all?
Oh my goodness, that's amazing question. So let me explain to you all what the health span is. We know what a lifespan is. That they give us seven score, I don't know, 70 plus years to live, right? That's our lifespan. But imagine your health span is how many years in that life that you have, how many years have you been healthy? What if
Mm.
we can change that? And that's what we're doing here. We're making the changes with our food, what we're putting on our skin, what supplements we're adding, how we autocorrect some things. And so that whole scope would look amazing. And it is affordable. It is affordable, but it depends on what you deem valuable. Because you could go out there and you say, I'm gonna buy some kicks, I'm gonna buy this outfit that you're gonna wear one time. Whereas if we can make this switch and get your mindset thinking like, I can do this for my body and feel amazing, and I can go out and be creative, be the creative that I need to do what I need to do and to live in the manner that I want to live. And that the other material things are going to come. But first, we need to make sure we have this vehicle taken care of because it's the only one we're going to have. We've all probably had houses we lived in. We probably had a multitude of cars, but those are mechanical and structures. But we only have this one that we have to take care of. So I get excited about this because that health span to me, I feel like I'm healthier now at 55 than I was in my 30s because I made those changes. And like JoJo said, we have to give ourselves grace. I gave myself grace on this journey. I'm still learning. I'm still moving forward as to where I need to go, but I'm not stopping because I know how I feel. I know how I look, and I know I can help change other people's aspect of that as well. It's that health span that we need to start focusing on.
So I absolutely love the breakdown of health span versus lifespan. And it's looking like how long have you actually been healthy since you've been living? And sometimes people see this, has this philosophy of this is just how long I've been able to live, or people in my family live this long, or I've been able to see 87. But it's like out of these 87 years, how many of them were you actually healthy? You were vibrant. You can do for you. You can feel good about how you're feeling, and you're not waking up with the aches and pains, and you're not having to take so much medication just to keep living to the next day. And so I love the breakdown of health span versus lifespan, but I also appreciate you walking us through the the way you created your own healing treatment while being at Restore Wellness. When you break down the infrared lights, and you break down the sauna, and you're breaking down the cryotherapy, right? The cryotherapy, correct? The cryotherapy. And then you're saying, this is how I fit into this whole wellness solution with IV therapy, and why IV therapy is so important to society and to your well-being. Sure, let's and I don't even want to say devil's advocate, but talk about why someone would be hesitant to embrace IV therapy, knowing the benefits that you just told us. Why would someone be hesitant to move forward with IV therapy?
You know, that's a good question because I've had two things. I've noticed people, I don't like needles. And so I have to explain to them, I will put the tourniquet on and I'll stick you once and I'm going to retract the needle. And I have to make them understand the needle is covering a catheter. When I retract the needle, it's just that plastic catheter that's attached to the IV line that's in your arm. You can move your arm. There's not a needle sitting there. And I think a lot of people think, well, when I get labs drawn, the needle is in my arm. This is totally different from that. So I think that's one thing there. And the second thing, I was approached by someone, why would I trust you to put things in my body? And he explained when with the drive-through of doing the COVID testing, how they have the little vials, you don't know what's in those vials, right? And I explained to him, everything I have It's compounded in a pharmacy. It's labeled. It has a date on there. It's an expiration date. I handle it in an aseptic technique where I use alcohol. So you're going to be able to see the label. You're going to see what it has on there, where it comes from, a reputable source, and also know that me as a nurse out in the field doing IVs, I have a physician over my business. So not to say that they're any better, but you have to have a collaborating person with you to run things by if there was any question as to who you're serving and what things they need. So that was a question, those two questions, as far as, well, one concern about I'm afraid of needles. I can help anybody relax on the needle journey. It's all about where you can let your mind go and not even think about this. And this can be in conversation. You won't even feel me sticky, because by the time we're having our conversation, I would have already stuck your arm. You would have been good. I got that many times. And then, like I said, the second part was the validity of the ingredients I have is from a reputable source. So I can show you that as well. So those are the things that I come across. And then some people don't understand, well, why should I do it? And I explain to them how it helps, and they'll try it and they're like, oh my gosh, okay, I do like it, and they feel a difference.
Okay, so, and I thank you for breaking that down, because sometimes you have to speak to those things that people do not know, because IV therapy could be the first time they even heard about it, let alone be able to hear your benefits from it. People with endometriosis, polycystic ovarian syndrome, fibroids, how beneficial is IV therapy as a part of their healing journey, do you believe?
Oh, wow. So for me, and what I would say to that demographic, and I'm part of it too, I just have mine under control. It's the nutrients that you want to make sure you're getting. We have one, everybody should look into glutathione. I talk about her all the time. Glutathione is the mother of all antioxidants. All of our cells love glutathione because it helps to, it's an anti-inflammatory. It goes into the liver. The liver has so many processes. It's a major process, because it takes everything we pound into our body, and it helps either get it out of our system through a whole, all the organs, whatever, but it helps to cleanse our bodies. So glutathione, you want to add that into there. It also helps to call it the glutathione glow. It gives your skin a glow, but it is the mother of all antioxidants, and it helps to cleanse your body. So that would be something, because you want to look into anti-inflammatories, because it's an inflamed state that our bodies are in, where we have dis-ease. And so we want to eradicate the dis-ease. And so we want to have live an alkaline state, have our bodies in an alkaline state. So a lot of these things are going to put you in an alkaline state, so you will feel amazing. You won't have, like you said, the 87-year-old that wakes up with oh, my joints feel inflamed. Even I have my demographics talking about they're old. I'm like, you can call yourself old. I'm bold. I've never been this age to know how I'm supposed to act. I'm going to be who I'm going to be. And I feel as good. I just feel good. Like I feel good.
I like that. It's not that I'm old. I'm just bold enough to prioritize my health span over my lifespan. So no matter what it might say in regards to my date of birth and how many years old I am, I'm bold enough to know that I am vibrantly living one day at a time because of the decisions I make, because they're rooted in how I love myself, how I care for myself, and what I know myself deserves. So I love that. I love that vibe, Cheryl. I do. And I thank you for making sure you tell us exactly what anti-inflammatory to consider when getting that IV therapy in the mix for my listeners and my target audience. And so, Cheryl, Restore Wellness, yes, is no longer here. And Restore Wellness isn't on everybody's corner. In order for us to find a space that could provide us with the things that you said you were able to explore and experience within this job opportunity for yourself, that also really gave the shift to your own wellness journey, what is it that we should be looking for in our community to kind of see where we can go to explore IV therapy and cryotherapy and the infrared lights and saunas and compressions? Talk to us about where we can find these places.
All right. So a lot of those things, we group it in something called biohacking. And what biohacking means, you're doing alternative measures, and you're like, quote unquote, hacking how things could go. Like you're doing So for instance, the red light therapy. If you're feeling somber, you feel like you're a hint of depression. The red light therapy, the research shows if you do 30 sessions of red light therapy, it can help you get rid of that depression because it helps. I can't get into it too deep, but anyway, it's going to help make some changes and you come out there feeling really good. I've had quite a couple of clients that have come in because of that, because they did the research. So for the lay people, y'all, we can just do research on wellness center. Give them a call in your area and see what they provide. Do they provide a way where they can test your blood nutrients to see what you're low on? Believe it or not, some of the things we're feeling is because our hormones are out of whack. I do work here in Atlanta with a doctor called Dr. Jada. She's the Real Weight Loss Clinic. Dr. Jada does those labs and she sees what you're low in. And she was telling me, as far as those hormones, men and women, you can help get those things corrected where we may feel sad. It may be because our hormone is off. Our libido may be low because our hormone can be off, different things. And so if you can get that corrected and live a great life and have this great health span, it's just things to know what to look for. Like I said, wellness spa, wellness plan, wellness program. And a lot of these places are run by holistic practitioners. And you can go down the rabbit hole of it. And it's so fascinating to find out what you can do for your body, because besides take a pill.
So Cheryl, taking your nurse background and now that you're in a wellness space, taking a holistic approach, but still utilizing that clinical technique of IV therapy, in regards to these labs, when we're getting the blood test for the nutrients and the hormones, how does that differ from what we already get when we go to the doctor and we get our labs drawn? Because I know there's a change, because I've had someone come on before and they went with a holistic or integrative specialist, and this is what's tested in the healthcare system. But when you went with the holistic, you see how my hands left the screen.
Yep.
It was a larger lab. It was a more panels. It was a deeper level of approach to really see how does that differ in regards to that if we go to a wellness center or a wellness spa when it comes to looking at our labs.
Okay, so the regular way that they look at labs now, it's basically, if you can think about macro versus micro. So we're looking at the doctors are looking at the bigger picture, like your CBC, which is your complete blood count. It looks at red cells, white cells, all those different things. Or your chemistry is going to look at your sodium, your potassium, your chloride, things of that nature. They're looking at the big picture of it. Holistically looks at the micro, so the micronutrients that could compose a protein, like what actually are you lacking in, and then what things do you have that can help replete. So let me explain. So micronutrients, we talked about the glutathione, your vitamin C, your vitamin D, your vitamin A, E, K, all those little things, even the how many amino acids we have in our body, y'all. Forgive me, I can't think. But the amino acid panel, to look at that as well and see what you're low in. Let's get you repleted in that. And that helps build up your body again. So you are, in fact, getting that micronutrient panel just to see what you're lacking in and repleting. And then I do that as well for my clients when they do my program. There's, you have the antioxidants, the micronutrients, the antioxidant portion. So the antioxidants, a lot of us run out, we buy the echinacea, the chamomile, whatever. What if our bodies, when we do our testing, it shows us that the chamomile doesn't work for us, the echinacea doesn't work for us. I have a lab where I can tell you what antioxidants will work for your body. So I call it our soldiers, because when we're sick, we run out, everybody runs out and gets the echinacea and the zinc and the vitamin C. That may not be what your body needs. It may need rhodiola or something else. And so that will help fine tune where you're going to spend your money at to buy those certain herbs and things to replete in your body, because that's what you need. JoJo's going to need something completely different than what I need. And so instead of her running out or us running out to go get the same thing, we can, with our monies that we need, we can buy exactly what we need for our bodies instead of wasting on stuff that's not going to help us. And so that is kind of what the difference in these panels help. The larger ones, like I said, the macros are the doctor just wants to see if you have anything like your cholesterol can be off. Okay, but what about my cholesterol? What can I do to fix that?
I like it. And then typically their response is always, oh, just exercise and change the way you're eating, when they don't even know exactly how you're eating already. They're just assuming that you need to shift. And then they probably won't even tell you exactly what you need to eat. And if we go any deeper, what Cheryl just told us is what you need to eat might be very different than the patient before you that came in here might need to eat. And I love that, Cheryl, because what I have learned is in regards to functional nutrition is when you actually know your body and you get the right labs drawn, it tells you specifically what it is that you need. And there's no general approach. And I feel like in traditional medicine in our US society, there's this general blanket approach to everything when it comes to healing. And when you start getting really intentional with your body, because we already know the body is complex, which let me just stop right here. The fact that you are have a biology degree, you have a nursing background, you are specialty with your IVs, and now you have a holistic wellness background. There's a lot that comes in regards to how you make the decisions that you make and how knowledgeable you are in this space. So first I want to say thank you for really just breaking down your background and your experience and how you've navigated this for yourself. Because it shows you not just talking just to be talking. And when you were talking about the amino acids, I was like, I think it's 20 of them. And so I think there's 20 amino acids, but just with your background and your experience, you're really providing a lot of insight in regards to your well-being and your wellness for people in regards to their health span. So I just want to say, just take a moment just to thank you for being able to just lean into your light, lean into your experiences, the good, the bad, the ugly, the indifferent, to be able to show up here today, vibing the way that you're vibing with the education to help us. And so when you talk about going to these, well, first of all, if you're loving this episode thus far and you're watching on YouTube, make sure you subscribe to the channel, click that like, thumbs up thing, and then drop what you've enjoyed thus far in this episode. And if you're listening on your favorite podcast distribution platform, make sure you leave a rating and send this episode to at least 3 people that you love, that you want them to be inspired to have a health span and not just a lifespan. So I just wanted to say that real quick right now. And information for our products and services are in the description of this video. So keep listening, keep learning, but most importantly, keep vibing with us, y'all. So Cheryl, how expensive is it for us to get this in-depth knowledge when we come to some place like a wellness center or a wellness spa just to get these labs? Because I know a lot of times our insurance doesn't cover these things, correct? So how affordable is it for us to get this in-depth knowledge to better understand the root cause of what's going on in our body?
So I would say some of these tests, the panels are upwards of $200, $300. But remember, if you have an HSA or FSA, use those funds. Use those funds, y'all. Find out. And then we can go through, once you get that panel, you can go through and get those answers you need. And then also, some of the doctors, if you're in a plan, look for some that are DOs, doctors of osteopathy, because they're educated. They're still doctors. However, they may use the holistic approach more so. So they're still, your insurance will still cover, but they're doctors of osteopathy. And tell them, I am on this holistic journey. What can you help me with? You never know who they may connect you with. I mean, it's all about resources. And if we don't speak up for ourselves, y'all, we have to be advocates for ourselves. No one will ever know. So let them know where you are in this whole spectrum, because it's supposed to be a team approach. Like, it's the doctor and you, and we are a team to figure out this thing called our health together. But this is where I rock in this lane. Do you have any advice for me in this lane, or who can you direct me to that can help me where I am?
And I love that you said it's between $200 to $300 because it goes back to what you said about
Yeah.
30, 40 minutes ago in regards to value. If you can pay $200, $300 for this, that, and the other, you should be able to invest that $200, $300 into knowing what state your body is in, what your body is lacking, what your body has a lot of that could help replenish in some other aspect. And so that knowledge within yourself. And I just a relatable moment for me, like having the surgery and waking up and him saying it's stage 4 endometriosis. I've never heard of endometriosis. I didn't know my organs were covered in cysts and scar tissue was binding fallopian tubes and cysts were on my ovaries. That just shocked me because for me on the outside, I felt like I was good. I felt like I was okay. I felt like I had a decent lifestyle at the time to where I wasn't causing my body so much harm. But that overwhelm of distress, constantly just keep pushing and pushing and pushing and not really managing the distress in my life, not being as educated in regards to what the dairy was doing, what the processed sugar was doing, what the processed foods were doing in my life, even if it wasn't a lot of it, still what it was feeding the things on the inside of my body. Like that was an eye-awakening experience to me that said, you know what? No more of me acting as if I don't know what I'm doing can't play a part in my body, because we know that the body keeps score. We know how powerful you only get one body. So why not be extra mindful in regards to how you move it, how you choose the foods to nourish it, and then most importantly, how mindful you are to care for it and love it so it can give you the things that you want out of this life because you know you deserve it. And so for me, that was the shift. You know what I'm saying? And it's that knowledge, and then that level of knowledge empowers you to advocate for yourself, where you won't just take what someone comes in the room and says, well, you know what, Cheryl, I think you have a tumor. How sway when I've been improving the things that's happening for me. So I just love that you were able to break that down, give us that insight in regards to IV therapy, share your story with transparency, and then say at the age of 50 plus, I feel more vibrant in my health span than I did at 30. And normally that's the time when people think they're still really living. And usually in the 30s is when things start really shifting. They say you've been living this way for 20 going on 30 years. It's not adding up. It's not contributing to the health span that you really want to get to. You might need to start considering to do some things a little differently if
Yeah.
you care about you. And
Yes.
I think that's the big thing. And so I know we talked about restore wellness, and you started talking about in your own business. So we know that there was a time where that journey ended for you. And so I just wanted to say, Cheryl, that I'm so grateful that the journey and the path that you went on and the vibes that you embraced took you to restore wellness so you could get exposure into IV therapy, into the cryotherapy, into how the body's nutrients needed to work. It's adding to your nursing, it's adding to your biology background, and you're seeing how beneficial people are able to go and be vibrant just after one appointment and being able to leave, not wait 90 days, not wait 6 months to feel better. They automatically are walking out feeling better and being vibrant. That for you was major. It was a life-changing experience for you. And the fact that it had to end, it ended on purpose for you to embrace a path that you're now being able to live within your own journey, within your own vibe, to be able to make a mark and leave a legacy, to continue to heal your people, but most importantly, continue to heal you. And I think a lot of times we miss out on the fact that as we're going through these things and people are ready to ridicule you or think negative in regards or doubt how you've been able to heal you. And it's just like, I didn't do it for you to believe in me. I did it because I needed to live for myself. I did it because I needed to be able to feel vibrant. I needed to get back to me. I needed to love me. And because I was able to do it for me, and I have been able to do it for other people, I'm only here to help those who want to be helped the way I know I can help them. And if you don't have that open mindset to embrace a journey and to explore the options that people are giving you, $200 to $300 to get labs that are going to be able to give you a more holistic view of what's happening on the inside of your body, so then you can go advocate for the treatment that you deserve, that you believe you need. That's taking your power back. And so, y'all, this power that you get from being in pain enough, it needs to cause a shift in your life in order for you to go and be all the things that you can be, because that's what you deserve. That's what you were created to be. So if you haven't heard enough from me and Cheryl today in regards to how you should invest in your health span, because it's important, but not only that, to know how valuable IV therapy can be in regards to replenishing, but first knowing, then replenishing what it is. Now that you know what it is that you need to have, y'all, go be vibrant. Like you just need to embrace it. Shift your mind. Start today by saying what you're grateful for. Even if you're grateful you came across this podcast episode and you were able to learn something, take this information and do something with it. Don't let it just be another video or another podcast episode that you let slip through your fingers, because it could just happen to save your life or save the life of somebody else that you love. And so, Cheryl, I'm going to get into these last two questions, but I just want to say thank you for just being that beacon of light, but never stopping, even when the challenges get rough and the jobs might end. It's only the beginning of something new that you're about to embark. So never forget that and keep leaning into that. But most importantly, keep striving, sis, to reach the goal, because you know that's what we do. All right. So, Cheryl,
Yes.
with some insight, some tips for the male role models, the father figures, or even the spouses and partners, where their daughters, partners, people that they care about are experiencing painful periods, pelvic pain, chronic conditions like endometriosis, PCOS, fibroids, adenomyosis. They might have a diagnosis, they might not. What are some ways that they can show up and still be a part of the conversation and still be a part of the support system in regards to their loved ones?
That's a good question. So let me bring how my husband helped. So to be there with appointments, like I said, I still have my fibroids, but they don't bother me. But just to be in the room to hear, because just because it's a female situation, I think our village expands beyond us. We only have males and females in the world. So if we're going to look for them to be some beacon of support, they need to understand what's happening, and to have them in the room to understand this and such is what's happening, and this is what can be changing within her body, just so they can have that knowledge base. Because if we talk about the cramps we're having and they don't know, oh, it's okay, it's just some cramps, they don't know how we're feeling. But if they know, they're in the room and understand from the verbiage that the doctor explains, and the doctors need to make sure, you guys, make sure your doctors explain it in layman's terms. Don't let him or her talk over your head and you're like, oh, I understand. No, tell them to break it down for you. And that's your right to know. Even if they may seem rushed, you're in that appointment and you find out. So get that information. But have your significant other in there so they can understand what you're going through. So they can know, oh, let me be a little more supportive on this end. And I find that with me, with my husband, like he's so supportive. Like I haven't had cramps in a long time, but when I did, he would rub my belly. He would make me some tea because he knew those types of things I needed, some chamomile tea to help relax me, or run a bath for me. I mean, put them in the know so they can help you, so you won't have to do it by yourself. And so I think that's how more men can be involved if they're there with their partners and not brush it off or negate, oh, it's just this, oh, they're just going through this. Even if your woman, your daughter is feeling very emotional, remember it's tied to our hormones. Help them, tell them you understand, you empathize with them. You can't understand what we're going through, but you empathize and you want to be a support and you want to be a light for them to be able to go through this and not be by themselves throughout this ordeal. So be very supportive in that respect.
I absolutely love that. And the first thing you said was be in the room. And I want to take that a step further. Be in the room, meaning being in the doctor's office, being in the
Yes.
room is what you meant.
That's
And
what I
when
meant.
you have them in the room at the doctor's office, they're now a second advocate for you. But before being in that room, being in the room of wherever you were prior to being at the doctor, being present.
Yes.
Because if you're present there, you're able to account for the experiences that she is having to be able to advocate on her behalf when you get in the room with that doctor, because it's also harder for them to hear us at times to really know what's going on. But if it's you and it's them telling the doctor what it is, then it's harder for them to ignore. It's harder for them to look past the issues that are really what it is that you're going through and what's happening. And then I love that you said, make sure the doctor explains it to where you understand. Don't just feel so overwhelmed with the information that you just like, I don't even know what they're talking about. I just heard them and you're gone. Get it, break it down for me. Go get me a printout. Give me the resources. You advocate for everything that you need to get an understanding, because once you get that understanding, you'll be able to take that understanding and make an educated decision on what your next step is going to be that you believe is best for you. And so I love that you walked us through. Make sure that you are in the room.
Sure.
And then you also talked about the routine that you already have. You know, a calming bath helps you. A rub on the stomach helps you. A certain type of herbal tea helps you. Making sure they know what actually provides you with some form of relief. Mm-hmm. Letting them know those things so then they don't just sit there, what you need. I don't know what you need.
Right.
Be in the room and utilize them being in that room. All right. So last question, Cheryl. Mm-hmm. If you could have a meal with any historical figure, who would it be and what would y'all eat?
Any
historical figure.
Oh my God, girl. Ooh. Well, I'm gonna have to go with Almighty, because if I can have a meal with God and I can be like, God, I thank you for the times that you put me through, because we don't understand why we go through it. Like you said, all those moments, I didn't know it was going to bring me to this area. Not that I would ask him, God, what's next? Because I know it's all going to be good, because that's how he is. But he can explain some things as to, I took you through this because of this. And this is what to expect, and I have you in the end. Like, I have you, I'm going to win. So I already have relief and I'm at peace because I know who I'm following. But to sit there with God and have a conversation, oh my God.
So what y'all eating?
Say what?
What y'all gonna eat?
What we gonna eat? Oh my God. Let's see. I'm gonna have me some what do I like me some roasted vegetables.
What kind of roasted vegetables you having with God?
Girl, let me have some roasted. Okay, I'm gonna do some Brussels sprouts.
Okay.
Some carrots, some cabbage, some onion. You gotta have some onion in there. I might add some tomatoes and roast that up with some good seasoning. Have some good rice, some basmati rice. I like a little spicy drip on there. I love me some garlic bread with some butter, or even put some olive oil on there. I use, oh my gosh, I can't even think of her. Emblem olive oil. When I tell y'all Emblem olive oil is a black owned, look up Emblem olive oil. She just won a grant.
Come on, grant winner.
$250,000. Like, I want, yes, Emblem olive oil, y'all. Amazing. Emblem olive oil on my bread. Have me some wine. God, let's chop it up. Let's chop it up. And for dessert, some peach cobbler. I might want some salmon in there if I can get that salmon grilled to perfection, however I want it. A little bit. I don't need a lot, just a little bit.
I love it. I love it. So Cheryl, tell the people where they can find you.
Wow. So y'all can find me at Vibe, VYBE _with_Cheryl on Instagram. My website is ivibewell.com. And I don't even know what else. What else? I have a Facebook, but it's just a regular Facebook page. If y'all just want to come on and get inspired. And I didn't get to tell them what Vibe meant. Visualize yourself better every day. I'm all about positivity and bringing the light to people. I was once in darkness, and when I came out of the darkness and I found this new field that I love, it helps me to with my practice with other clients to bring them out of that darkness, bring them into the light. And then the I vibe is IV, intravenous vitamins your body embraces, because we need that. We need our bodies to embrace this new living, this new journey it's on. And so I combine those two together. And so I'm bringing that vibe to you. And I just lastly want to say, let me curate your vibe. That's what I do. However you want to feel, what is it that you need? Let me be the one to help you get there.
I absolutely love all of that. I
Thank,
do. I
thank
do. You're welcome. You're welcome. Y'all, it's your healthy habits and lifestyle coach, Giovanni, and I help those with endometriosis and polycystic ovary syndrome reduce chronic pain, eliminate stress, and minimize irregular or heavy periods through my M to the third degree healing empowerment formula, y'all. That's rooted in mindset, mindful eating, and movement. It's a comprehensive approach. Click the link in the description of this episode and come vibe with me, y'all. Come vibe with me. So I appreciate you, Cheryl, for coming through, shining your light, but most importantly, vibing the way you vibe and all the meanings of your vibes to the vibe. So I appreciate it. Thank you so very much. Yeah, I hope that you were empowered to continue to embrace your healing journey, keeping you first, but knowing that you deserve all the things that comes with living a life filled with vibrations, high vibrations, with an intentional health span all around that doggone thing. Y'all, we love you. We thank you. But most importantly, thanks for vibing with us, y'all.
Thank you. Thank you, JoJo. I love you, girl. Thank you.
Love you too.